नमस्कार। स्वागत है आप सभी का फॉक्सी के इस ज्ञान प्रवाह में, जहां हर शब्द बनेगा कामयाब। सेहत की राह में कैंसर से लड़ना है, डरना नहीं। रोकथाम से जीवन संवारना है, रुकना नहीं। हर घर फॉक्सियंस का नारा अमर रहे। हर घर फॉक्सियंस का नारा अमर रहे। ज्ञान का दीप जले और हर मन को छुए। सही जानकारी ही हमें शक्ति देगी, स्वस्थ भारत की ओर राह दिखाएगी। आइए हम सब जुड़े इस कारवां में एंड सब मिलकर स्वस्थ भारत का सपना हो साकार। आइए साथ मिलकर यह संदेश फैलाएं, स्वस्थ समाज की ओर नए कदम बढ़ाएं। इन्हीं शब्दों के साथ मैं आपकी होस्ट, चेयरपर्सन फॉक्सी नॉन कम्युनिकेबल डिजीज कमेटी, आज आपका इस ज्ञान प्रवाह पॉडकास्ट सीरीज में स्वागत करती हूँ। और स्वागत करती हूँ अपने दो उन महान हस्तियों का जिन्होंने मेरे साथ आज इस पॉडकास्ट सीरीज में ज्वाइन करा है। एक हमारी प्रेसिडेंट मैडम डॉक्टर सुनीता मैडम, मैं जिनका तहे दिल से शुक्रगुजार हूँ, और दूसरे डॉक्टर अल्पेश गांधी सर, जो कि हमारे पास्ट प्रेसिडेंट हैं। दोनों का मैं तहे दिल से स्वागत करती हूँ। आवर फॉक्सी इज कमिटेड टू स्प्रेडिंग authentic medical knowledge. Today's podcast focuses on prevention of non-communicable disease, especially cervical and the breast cancer. Let's empower every family with awareness. ये पॉडकास्ट आज 212वां पॉडकास्ट है। कैन यू इमेजिन, इससे पहले 211 जो पॉडकास्ट हुए उसमें बिकॉज ऑफ दिस पॉडकास्ट ज्ञान प्रवाह सीरीज हम सब ने बहुत कुछ सीखा, बहुत से नए एक्सपीरियंस पाए, बहुत ज्ञान का रियली प्रवाह हम लोग के अंदर हुआ। ये सब किसकी वजह से है? हमारी जो विजनरी, मोस्ट डिवोटेड, मोस्ट हम्बल फॉक्सी प्रेसिडेंट सुनीता मैडम की वजह से। मैडम, मैं आपका रियली रियली तहे दिल से शुक्रिया अदा करती हूँ और गदगद होती हूँ। मैडम, आपका जब भी हम ओरेशन सुनते हैं तो रियली this time when we heard your oration in south zone about the this uh, it was really enlightening and very good.
Regenerative medicine.
And yes, madam, this was very good and enlightening. We all become so enlightened, and really this was very good. And मैडम, ये ही नहीं, मैं कौन कौन से पल या क्षण याद करूं या बताऊं कि जब हम सब भाव विभोर हो जाते हैं आपके इस नेतृत्व की वजह से, जो रियली अद्भुत है। मैं एक आध क्षण भी याद करती हूँ कि जब हम लोग थोड़ा सा मायूस हो जाते थे, कि मतलब आपके साथ एक आध फोटो खिंचाई तो आपको लगा कि हमारे चेहरे पे थोड़ी सी मासूमियत आ गई, तो आपने दोबारा बुला के हाथ पकड़ के फोटो खिंचाई। दैट शोज योर हम्बलनेस एंड नेतृत्व एंड द ग्रेटनेस। आपका रियली जो ज्ञान का प्रकाश है उसने फॉक्सियंस का सबका रियली मान बढ़ाया। एंड
Kanchan, the
रियली
podcast is of
मैडम,
you and Alpesh.
आपके लिए बस दो शब्द बनते हैं। मुझे पता है आप अपने बारे में ज्यादा नहीं तारीफ सुनना चाहती हैं। दैट इज अगेन बिग उपहार हम लोग के लिए। एक तरह से सुनीता मैडम का नेतृत्व है अद्भुत उपहार। फॉक्सी का मान बढ़ाएं और करती स्वास्थ्य का प्रचार। उनकी दृष्टि में सेवा, उनके स्वप्न में प्रकाश। उनकी दृष्टि में सेवा, उनके स्वप्न में प्रकाश। हर घर पहुंचे स्वास्थ्य का सच्चा विश्वास। ये मुझे लगता है कि मैडम पर जो गगनगिरी महाराज की कृपा है, जो उनका स्पिरिचुअल एस्पेक्ट है, उस सब की वजह से ये सब हो रहा है। तो मैम, हम आपका
Thank you,
स्वागत करते
Kanchan.
हैं।
Thank you.
प्लीज दो शब्द
I
आप
need to stop you
बोल
definitely.
के अनुग्रहित करिए।
I need to stop you definitely, Kanchan. Thank you so much for your kind words. I don't know whether I deserve everything, but your Hindi, I can't speak the way you are speaking. I'm a Marwadi girl, but तुम्हारा हिंदी इस बहुत ही ऊंचा स्तर का है। इतने ऊंचा स्तर का हिंदी हम नहीं बोल पाएंगे।
मैम,
और हम शायरी भी नहीं बोल पाएंगे।
हम शायरी भी नहीं कर पाएंगे। हर पॉडकास्ट में उसका स्टार्ट, उसका एंड शायरी से होता है। यू नो अल्पेश, आई एम so thankful to God that I got a 30 diamonds. All my chairpersons are fantastic, doing amazing work. The amount of efforts they put in for the podcast is amazing, and I'm so thankful to each and every one of them for getting the best of the faculty. And 45 minutes their dialogue discussion is amazing. And Kanchan, the incidents, probably you may be talking about the Udaipur, when people made me keep quiet, but then I came and I took a selfie with you, because I strongly believe that if I would not have been in chair, probably I would not have bothered so much. But when you sit on a chair, it is very important that you take care what you made other people feel. It's very important that you need to be grounded, you need to be reaching out to everyone. And that's the reason I came to you and I took it. It is very important. People will remember when you are on some position how you made them feel. And I want my each and every chairperson to feel absolutely valued, absolutely of a great importance, and their contribution to Foxy is always acknowledged. Alpesh bhai, thank you for coming on a Foxy platform. You have done amazing work on a digital platform during your presidency. I think you have done 10 times more than any one of us, because being in a COVID pandemic to do in such a odd situation, I know I was a IEG president that time. I know how it goes and how it feels and how you one can bounce back. So we are thankful to you for surviving the Foxy, for helping the every Foxian to win in the pandemic. And that will be always remembered by every Foxian and by every president of Foxy. Thank you so much for being here today. And I'm sure I'll be joining the viewers link and I will be enjoying that.
Thank you, madam, for your wonderful words of blessings. Thanks. It's great for me. About the Dr. Alpesh Gandhi, sir. Really, he is a wonderful past president. I think, as we all know, that the concept of non-communicable disease committee has been brought into Foxy by him. About him, his contribution in improving MMR, maternal mortality ratio of our country, is a great and needed to reduce it from 115 by 2015 as per the MGD. Our MMR was improving till 2011 to 2012, but after that improvement was not as per desire. So by his effort only, Dr. Alpesh Gandhi changed the picture quite effectively. So he had made lot much of effort to reduce MMR of India, and he worked at the level for it. He traveled extensively across the country, developed modules, organized many workshops, international conferences to bring the awareness among the common people on the critical care in obstetrics also. And he advocated the concept, its need and role of critical care units in obstetrics at all levels. And he published Foxy policy on importance of HDU in obstetric care. So he was invited as one of the experts to prepare the national guideline for establishment of obstetrics HDU. And he provided the qualified experts to the country. He developed Foxy's course and syllabus and requested reputed health universities in India to start specialized fellowship courses after post-graduation. His book on principal care of critical care in obstetrics is have a great value. So, sir has done great work even during the COVID time to fight against the COVID-19 infection in the pregnant women in India. He was invited by Honorary PM as the president of the Foxy for the video conference meeting to combat COVID-19. Was great. He prepared India's first Foxy guideline on pregnancy with COVID-19 infection on 29th March 2000. 2020. He advocated to include pregnant women with a labor pains as special category in testing criteria for COVID-19. He was invited.
Kanchan,
Sir,
can we
sir,
start
it's my pleasure that
podcast?
I
Our
am
interview.
here with
Yes,
both
yes.
of you, great Foxy presidents in the same frame. So thank you for being here, and thanks, madam, for giving
Thank
me
you.
a chance.
Thank you. Enjoy the podcast. You will learn a lot and you will make every one of us to learn a lot. Thank you.
Before Dr. Sunita leaves and joins from the other link, I would like to say a few words. Under her able leadership, Foxy is very vibrant and doing lots of activities. I would like to congratulate Dr. Sunita, our President Foxy, for this wonderful initiative. This is a very great initiative. Podcast. It's a great platform and great initiative to sharing knowledge and to reach to thousands of people and our members as well. And the name Gyan Pravah is very symbolic, very catchy, and I think meaningful. It itself suggests the purpose of the podcast. And the episode number 212 itself suggests how popular it is, how consistent it is, and how much impactful it is. So, once again, congratulations from my side. And thank you for inviting me for today's podcast. Thank you, Dr. Sunita, Foxy, and Dr. Kanchan.
Thank you, sir. So, sir, again, welcome to this podcast series. क्योंकि सर ये आपका एक नेटिव आइडिया था जस्ट टू ब्रिंग द नॉन कम्युनिकेबल डिजीज कमिटी फॉक्सी एंड द एनवायरमेंटल कमिटी सर तो सबसे पहले आई जस्ट वांट टू आस्क टू यू दैट व्हाट वाज द आइडिया बिहाइंड दिस committee, why you thought of to bring this committee, just in your words, sir. This was really a great idea, so that I came into existence. Thank you, sir. Yes, yes.
Thank you very much, Dr. Kanchan, for bringing this question. I'm happy that you bring this question. See, non-communicable diseases are the diseases that are not that are chronic diseases and not pass from person to person, and they are not communicable, and they are like tsunami. At present, we can say they are like tsunami, and if we want to control this tsunami, want to control the disaster, then we have to start work from the with women of reproductive age, from pre-conceptional period, and I would say even from we can say from the adolescent health, fetal origin of adulthood diseases, pregnancy related complications like hypertension disorder, gestational diabetes, preterm delivery, fetal growth restriction, and this all can lead to, and even women's lifestyle environment problem, all have direct or indirect effect, and they can lead to NCDs in women and in future generation. And
Yes, sir.
this period, reproductive period, and this preconceptional period provide us an unique opportunity to us to improve women's life course with health, with the aim of preventing NCDs in the future life and later in life, and in the even in the next generation. And if you look at the SDG goal, which was declared in 2015, which we all have to achieve by all countries have to achieve by 2030. And as per the goal number 3, we need to ensure healthy lives and promote
Right.
well-being for all at all the ages. And by 2030, we need to reduce premature death from NCDs by 1/3. So I think, and there are many aspects of the lifestyle which can lead to NCDs. And India is one of the countries having the maximum, we can say, malnutrition, at the same time obesity, at the same time we can say early pregnancy, yeah, and we can say even early marriages. So all this can, and even sometimes women entered into pregnancy with already pre-existing NCDs. So all this can lead to NCDs in women or in future generation.
Right.
And that is why I think, and even obesity. When children born to obese women, there are the risk increases by twice, double than having the gestational or having the diabetes mellitus in children. So many risks are there, and certain cancers we all know that if they are detected early and if treatment is given, then even in cervical cancer we can cure 93%. So being I think healthcare provider, we all are the healthcare provider professionals, and I think as a policymakers and as Foxy, which is a main stakeholder of women's healthcare in India, I thought that we should take the ownership of this problem, and we should come out with some solution. And we declared during the installation ceremony, as my president of Foxy during Lucknow AICUG, we declared that now we need to add one more priority in our mission and vision, and we declared that we will now work for overall health of women's healthcare along with the maternal and neonatal mortality. And we decided to come out with two important committees to work on this, and that is NCD committee and environment committee. And I congratulate you because you are leading, you are the first chairperson of this committee, and you are doing
Thank you,
excellent
sir.
work. I am observing you. I should not say, but I am observing your activity, how you are
Thank
working
you,
as
sir.
the first chairperson of this committee, and I am happy that how I'm happy with your work. And you are leading the path for the next year and also for the next chairpersons. So thank you very much, you personally also. And that was the purpose behind starting of this NCD committee in Fox.
Thank you, sir. Really, I am happy by your all blessings and blessings of the senior. Actually, मेरे को काम करने का मौका मिला, गाँवों में गई, मैं कानपुर के आसपास के सारे गाँवों में गई, रूरा में गई, और अकबरपुर में गई, विलेज होरा में गई जो कि पास में था। हम लोगों ने कैंप्स बहुत सारे ऑर्गेनाइज करे, और बहुत ही अच्छा लगता है जब गांव गांव में जाके आप अवेयरनेस क्रिएट करो। आपको पता चलता है कि रियली कितनी अवेयरनेस की कमी है जिसको हम दे सकते हैं। जब हम नॉन कम्युनिकेबल डिसीजेस के बारे में बात करें सर, जैसा कि आपने बताया कि नॉन कम्युनिकेबल डिसीजेस आजकल धीरे धीरे हम लोग देखते जा रहे हैं, उसमें जो कि उसके मॉडिफाइबल फैक्टर्स हैं, जैसे कि तंबाकू, पान, गुटखा, और स्पेशली ये अल्कोहल वगैरह ये विलेजर्स लेते हैं उनको रिड्यूस करने के लिए, और कुछ बहुत सारी ऐसे, जैसे कैंसर के बारे में आज आप बात करेंगे, तो कैंसर अवेयरनेस भी गांवों गांवों में फैलाना बहुत ज़रूरी है। इसके लिए हम लोगों ने VIA भी करा, उसके कैंप भी लगाए, ताकि हम लोग सर्वाइकल और ब्रेस्ट कैंसर के इंसिडेंट्स भी गांव गांवों में कम कर पाए। अभी 2 टीके जिंदगी के जो हमारी फॉक्सी की प्रेसिडेंट मैडम ने भी ये एक अभियान चलाया, उसके तहत भी हम लोग गांव गांवों में जाके 9 से 14 साल के बच्चों को या महिलाओं को, अपने बच्चों को ये वैक्सीन देने के लिए प्रेरित किए, उनके बारे में जानकारी दिया। और रियली ये कमेटी लाने के लिए मैं आपकी बहुत बहुत तहे दिल से शुक्रगुजार हूँ कि आप ये कमेटी लाए, और ताकि हम लोग इस माध्यम से फॉक्सी के माध्यम से हर घर में पहुंचकर अपना ये संदेश जाहिर करें। और जैसा कि आपका भी एक सपना था कि हम मैटरनल मॉर्टेलिटी रेट को कम करेंगे, तो उसकी दिशा में हम अपना पूरा पूरा प्रयास कर रहे हैं। सर बहुत बहुत धन्यवाद। मुझे लगता है कि आपका ये जो प्रयास है उसको हम लोग पूरे प्रयत्न से आगे तक ले जाएंगे, और रियली नॉन कम्युनिकेबल डिजीज कमेटी मेरे बाद, मैं और जब तक मेरे बाद आगे जो भी आता है वो इस दिशा में आपके गाइडेंस से कार्य करेगा, ताकि हम लोग वर्क करें। सर मैंने सुना भी है और आपके वर्क को देखा भी है सर, आपका स्पेशली विलेजेस में सब जगह एक तो मैटरनल मॉर्टेलिटी रेट को रिड्यूस करने के लिए एफर्ट है, उस दिशा में आपका क्या प्रयास है वो मैं जानना चाहूँगी। दूसरा अगला क्वेश्चन होगा, ब्रेस्ट कैंसर व सर्वाइकल कैंसर की अवेयरनेस के लिए आपने क्या करा। सर बारी बारी से एक एक चीज चलते हैं हम लोग। मैटरनल मॉर्टेलिटी रेट के बारे में कुछ बातें करेंगे।
So maternal mortality rate in our country,
जी जी
we have to achieve what we have to achieve as per the MDG goal, we could not achieve. Up to 2011, every year we were improving. An improvement was good, but after 2011, at one level, the improvement was not so desirable.
Right.
It was not as per the desirable. And we
Right.
were trying to find the reason behind this, because our doctors are available, they are experienced, they are dedicated. And now the hospital delivery rate has been increased.
Right. Right.
By that time was increased to 85% from, we can say, 28% in the 2000. So by 21, by 2011, it has reached to nearly 84-85%. In spite of that, 85% mothers were reaching to the hospital. Maternal mortality rate was not, we could not achieve as per the desirable. So we thought, what is the reason behind this? And we came to know that quality obstetric care is required to save those mothers who are reaching to the hospital and dying. And from this, we
Right.
realize the concept of quality obstetric health care, critical care in obstetric, and need of obstetric HDU to take care, to monitor those pregnant women and to take care of those pregnant women in
Right.
our country. And then at the Foxy level, we updated our members, and then at the government level, we do a lot of advocacy. And at the end, government also realized and then decided to come out with the guideline of obstetric HDU establishment, and then in the operational guideline for the obstetric HDU, and
Okay. Okay.
which was released in 2015 and 16, and now government has made it mandatory for all the medical colleges to get permission to start medical colleges. They must have this obstetric HDU. And now already more than 550 obstetric HDU are working in our country. These are the government in public hospital, in private hospital, many more are there. So now the maternal mortality is improved a lot, and already 10 states in India have already achieved SDG goal, which is
Right.
less than 67 by 2030. And now our maternal mortality rate of our country is in 2 digit, it is 97. And I think by 2030, we will definitely achieve this goal. So this is regarding the maternal mortality.
Very right. Very right.
Your second question was regarding the cancer, women's cancer. And I would say, for maternal mortality, because of the efforts of the Foxy and government and at individual level and NGOs, we are on the right track. But at the same time, what I have observed in 2020, that maternal deaths from the because of pregnancy in our country was at that time 25,000, whereas deaths from the
Okay.
breast cancer around 70,000, and breast from the cervical cancer around 62 or 64,000 at
Oh,
that time.
oh, yes, yes, yes.
So we thought, okay, we should now, this is time to add one more priority. We should look also for this cancer, which are the preventable,
Right.
and because
Right.
of some problem, awareness problem,
Right.
and accessibility problem, there are
Right,
the
sir.
problems. So we come out with the modules. We organize TOTs for our trainers. We have reached to the we identify the area where mortality is maximum. We trained we can say ASA workers and all those who can help us. We identify in the northeast area, we identify the 11 hospitals who can manage, who can provide treatment to this hospital. So we try to help in establishing the referral link in northeast region, and
So
we
basically, we did a
conducted
lot much of
studies
work.
in the northeast regions. Yeah. So at comprehensive level, at the level from advocacy at government level, from updating our members, from establishing links, from training of paramedic staffs, and we also organize public health educating programs on the online platform. So we have worked at all the levels and at the comprehensive, we can say in comprehensive
So, sir,
package.
really, I think that today's podcast should be watched by even all the persons, maybe a Foxian, maybe any branch doctor, or maybe non-medicals, because this highlights really the Foxy, and we Foxians are doing lot much of work for our nation. We really, really by our heart want that the maternal mortality rate should improve, as a lot much of work you did in your presidentship, and also at the ground root level,
And in
even to improve
2019,
the.
in 2019,
Right.
under the leadership of Dr. Nandita as the president, we also come out with the guideline of cervical cancer management.
Right, right, very, very right. So बहुत सा काम किया, मैटरनल मॉर्टेलिटी को रेट को कम करने के लिए भी. मैटरनल मॉर्टेलिटी रेट यूजुअली आई थिंक कि बहुत सारे केसेस में जब ये मैटरनल मॉर्टेलिटी रेट बढ़ने के चांसेस, वाई, बिकॉज देर आर सर्टेन मेडिकल कंडीशंस in the pregnancy also, they are associated. These are the non-communicable diseases associated with the pregnancy. They can increase the rate of mortality. By controlling them and creating the awareness, we can reduce the maternal mortality. And the other thing, as you highlighted, sir, about the breast cancer and the cervical cancer. First of all, I come to the breast cancer. Really, as we know, this is one of the leading cause now of the deaths of even woman, mother, or the woman which develop the breast cancer. So, because both of these cancers are preventable, so really, what are the preventable measures? I just want to hear from you, sir, which can be adopted for the breast cancer first.
See, first of all, I would like to inform about the scale, about the how much serious the breast cancer
Right.
problem.
Yes, yes.
It's a big and serious public health problem, and it's a most common cancer in women in the world
Right.
and even in the India also. If we look
Right.
at the data of 2020, then 2.3 million new cases were detected in the world, and 6,70,000 deaths were reported from the breast cancer. And in India, at every 4 minutes, one woman is diagnosed with the breast cancer. And for every two women diagnosed with the breast cancer, one woman dies because it is diagnosed late in the stage 3 or stage 4. So this is very important.
Yes, sir.
And if you look at the, we can say this is because of many reasons, because lifestyle, urbanization,
हाँ जी.
not traditions of not giving breastfeeding or late marriages, very late marriages. So many other things are there. Social problems, of course, are that women have to face certain cultural norms, certain they are financially not restrictions are there, mobility restrictions are there. So many reasons. Awareness is not there. Accessibility problem. They are not knowing about the severity of the disease. They are not knowing about how to examine self examination of breast. So they do not know the importance of clinical examination. Because of all these things, breast cancer incidence increases, and that is why we need to do. They do not know which are the risk factors which can lead to
Right.
breast
Right.
cancers.
Right.
So they are lack of knowledge, and we need to do provide knowledge to them. Of course, screening and management, of course, we need to provide them.
राइट सर. सर, तो ब्रेस्ट में कैंसर को प्रिवेंशन के लिए व्हाट आर द रीजन, पहले तो आपने ये बताया. रीजन में भी मतलब द पर्सन वी हैव टू मेक द अवेयरनेस दैट मे बी बिकॉज ऑफ द जेनेटिक कॉजेज जो कि नॉन मॉडिफाइबल हैं, और मॉडिफाइबल कॉजेज क्या लाइफस्टाइल एंड डाइटरी हैबिट्स, दे आल्सो अफेक्ट द डेवलपमेंट ऑफ सर्वाइकल कैंसर. सर, आप क्या कहते हैं? What are the lifestyle factors and the dietary factors which increases the chances of the breast cancer? Are there any?
See, first of all, we should also try to understand the trend in our country, in India. And it is really a very disturbing trend, because younger women are now
And the
more
use of the
diagnosed.
pills. Use of the pills also.
Yeah, because now younger women are more diagnosed with the breast cancer. Before 2 decades,
Right, sir.
those who were diagnosed with the breast cancer, out of them, 31% were below the age of 50 years. And now it has increased to 48 to 49%. That means 50% of the women who are diagnosed with the breast cancers are below the age of 50 years. And why this happens? because of the lifestyle changes, because of
Right.
the urbanization, because of the delayed childbearing, younger populations are affected, and there are certain challenges also in our, particularly in infrastructure gaps are there.
Right.
So we do not have trained personnel, or in some of the tribal areas or rural area, we may not have the facility of the mammography. So many problems, challenging are there. But at the same time, awareness is the first thing which we should concentrate on it. And there are certain risk factor. We can divide it into modifiable and non-modifiable, and they
Right.
should know these factors so that they can save themselves from this risk factor, and so we can reduce the number of breast cancers. So the first, we can say, as the age
Right.
increasing, the
जी.
possibility increases, risk increases. Above the 40 years, it increases significantly. So number first is
Right.
age. Second is family history. If a first degree relative like mother or sister in the family is suffering from breast cancer, then the risk is double. Then certain genetic mutations like
Genetic.
BRCA1, BRCA2 gene mutation can raise lifetime risk up to 70%.
Right.
Then past history, if someone is having a prior breast cancer or some breast benign diseases since prolonged time, risk increases. And one more important thing is, we can say this is the recent thing, that is early menarche. Now we are come across early menarche and late menopause.
Late.
Because of these, there is a longer lifetime exposure to estrogen,
Is
which
true.
is again which can lead to uh, a risk increases. So and there are certain non we can say modifiable risk factors.
OCs. What about OCs?
Modifiable risk factors are alcohol consumption.
Right.
So every one drink per day increases risk by 10%. Obesity, excess fat raises estrogen level. So we should try to keep the body weight normal as much as
Normal.
possible.
Yes.
Activity, sedentary lifestyle contribute to weight gain and hormonal imbalance. Smoking is also associated with the higher risk, increased risk, and the hormone replacement therapy. Try to avoid hormone replacement therapy, but if you need it, then try to take it for a shorter period or in a lower dose, if whenever it is possible, under the guidance of the gynecologist. And of course, reproductive choices, having a child very late or not at all, this is again a risk factor. And not breastfeeding at all or a shorter duration of breastfeeding also is harmful and can increase the risk. And diet is also very important. High fat diet, processed food, saturated fats, high sugars, all this can increase obesity and the risk. And of course, environment factors are there, like chemicals in plastics, cosmetics, pesticides. These all can increase the risk. So try to avoid all this risk factor wherever, of course, these modifiable risk factors are in our hands, and we can manage it, and we can try to remove from we can try to keep distance from all these modifiable risk factors.
वेरी राइट सर. तो इसका ये मतलब हुआ कि लाइफस्टाइल 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 इज वेरी इंपॉर्टेंट फॉर द मॉडिफाइबल फैक्टर, बिकॉज ये हमारे अपने हाथ में है. ये हमको अवेयरनेस फैलानी है, तभी हम इस टाइप की नॉन कम्युनिकेबल डिजीज से लड़ सकते हैं, पेशेंट्स को बचा सकते हैं और इस टाइप की मॉर्टेलिटी को कम कर सकते हैं. जैसा कि आपने बड़े अच्छे से बताया है कि लाइफस्टाइल को इम्प्रूव करें, एक्सरसाइज बढ़ाएं, डाइट अच्छी रखें, ये जो जंक फूड है उससे अवॉइड करें. और जो लेट मैरिजेस का आजकल ट्रेंड है, दैट ऑल्सो बैडली अफेक्ट्स वुमेन, बिकॉज इन ईच एंड एवरी एस्पेक्ट. पहले तो इनफर्टिलिटी के चांसेस बढ़ रहे हैं, ब्रेस्ट कैंसर के चांसेस बढ़ रहे हैं, एंड यूज ऑफ द हार्मोन्स ऑल्सो as OCPs or HRTs, which is the things they are consuming. They should reduce its duration and not taken without the medical opinion. थैंक यू वेरी मच सर, ये सब आप एनलाइट करने के लिए. अब जस्ट हम ये जानना चाहेंगे कि क्या इसके प्रिवेंशन के लिए फॉक्सी का क्या क्या स्टेप है, उन्होंने कहाँ कहाँ, जैसे अवेयरनेस के लिए सेल्फ ब्रेस्ट एग्जामिनेशन वगैरह वाले को हाईलाइट
Very
करा. जी
Very important question. And all women should know about the breast self examination and what to when to do and what to look
yes
in breast self examination. They should practice breast self examination regularly, and not it is not a replacement of clinical examination. Always they should keep this in mind.
right
First, this is not the replacement of clinical screening or clinic like mammography or sonography or anything, but they should know and they should practice self examination. It's a powerful tool for self awareness and early detection of anything if going wrong in their breast. So they with this they can become familiar with how her breast normally look and feel. So if anything they can spot abnormality, they can contact early, they can report early. Many breast cancers are first discovered by women themselves because they have felt a lump or some changes in their breast and they contacted doctors. 40% of the breast cancers are first detected by women themselves. So this is a very big number. 40% means a very big number. And knowing body helps a woman advocate for timely medical care. So one more thing is when to do that is when a woman is menstruating can examine a few days after menses is over because during menses breast may be heavy or it may be tender. So once menstruation is over, we can say on day 5th or 6th or 7th for fixed day they should decide, they should finalize, and on that particular day every month they should, after menses is over, they should regularly check their breast. And if it is already a postmenopausal woman, then they should fix one day in a month. Suppose first day of any month. So they should fix and they regularly should practice breast self examination on that particular day. So how they should examine, there are, we can say, two methods. They should follow two things. First is inspection, another is palpation. So in infection, they should stand in front of a mirror with arms at they raise their hands overhead. So there are fixed method protocols which videos are already there, photographs are there. So they should follow all these videos which already Foxy has published and it is there. So they should do how to inspect their breast as well as they should also know how to do palpitation of their breast, and they should know what to look. So they should try to find out whether is there any lump or not, whether is swelling is there or not, is there any thickened area is there or not. They should also try to find out is any redness is there or not, is warmth is there or not, and if they have any persistent pain in some area, so they should not down this thing. Even they should try to see the shape, size, and symmetry of both the breast. They should try to see the level of the nipples, and they should also try to see whether nipple is inverted or not, whether there is any discharge is there or not, or scaling is there or not. And they should also try to see whether skin dimpling or texture changes are there or not. Sometimes breast may have orange peel like texture. So they should not all these things. And if any abnormality if they detect, then they should immediately contact gynecologist or we can say oncogynecologist. Breast self examination is a simple procedure. It may take only 3 to 5 minutes, and there is no cost at all. Women can perform it at their women can perform it at their home, and they should practice it regularly. And one thing they should keep in mind, that it is not a replacement of clinical examination and other modalities like sonography or mammography. So I would say once after the age of 20 years, they should regularly do breast self examination, and every month. And after the 30 years, I would say every year at least they should contact a gynecologist or obstetrician. or oncogynec for once a year clinical examination. So this is minimum they should know.
राइट राइट सर, आपने बहुत ही अच्छे से, बहुत ही सरल शब्दों में ये समझाया। जो भी कोई ये पॉडकास्ट देख रहा होगा, इवन नॉन मेडिकल पर्सन भी कैन अंडरस्टैंड वेरी वेल द इम्पोर्टेंस ऑफ द ब्रेस्ट एग्जामिनेशन, सेल्फ ब्रेस्ट एग्जामिनेशन, क्योंकि ये ब्रेस्ट कैंसर के इंसिडेंस को बहुत ही ज़्यादा रिड्यूस कर देगा रियली, एंड दैट शुड बी डन। मैं यहाँ पे एक बात बोलना कहना चाहूँगी, स्पेशली सारे नॉन मेडिको या पैरामेडिकल पर्सन जितने लोगों ने ज्वाइन करा है, पहले ये ब्रेस्ट की कोई भी प्रॉब्लम होती थी, द पर्सन दे यूज टू गो टू द जनरल सर्जन, बट नाउ वी आर टोटली सेइंग दैट ब्रेस्ट इज अ पार्ट ऑफ gynae and gynae examination, because these are ladies who come to us as gynecologists for examination. So during the examination, general examination, or during the examination of the female at the time of puberty, or during the examination during the pregnancy, we can do the checkup of the breast and whisper in their ear that self examination of the breast is very important. There was an incident I just remember during our PG days. I teacher used to make us hear that during examination there was a student who was failed because she has not examined the breast during the pregnancy. During the pregnancy, the patient was having a breast cancer, but she did the examination only for the pregnancy, told the weeks. So now we suggest that each and every gynecologist should have a routine examination and should suggest our patient that they should do self breast examination. Thank you very much, sir, for enlightening us about this all. Now next question comes about the cervical cancer. Sir, I know that you
I just want
Yes, sir.
to add one thing. They should know the proper method of breast
Examination, as you
self-examination.
told in detail.
Videos are there on the website and at Fogsi website also. They should
Right.
follow this. It's a procedure, so long procedure. I may take time sometimes, so I did not go into it.
Right.
But they should know the proper method. And second thing I would like to add here is after 30 years, sonography is also very useful. It's a supplementary tool for younger women, particularly below 40 years. So
Right.
if anything in clinical examination, if your doctor find anything, they may advise women for sonography. And after 40 years, mammography is routinely usually advised, and they should undergo mammography once in a year regularly up to we can say between 45 to 54 years minimum. They should go for mammography annually, and after 55 it can switch over to twice at the interval of 2 years. So, and if gynecologist think required, then he may advise or she may advise for annual mammography also. But these things are important. They should know about the sonography, mammography. These all are the tools for the clinical examinations.
तो रिपीटेड अवेयरनेस फैलाने से धीरे धीरे द पेशेंट्स विल बी मोर अवेयर. आई रिमेंबर वन इंसिडेंस इन विच द पेशेंट was advised mammography, and because she was a high family risk case, but while advised she started weeping. I said, why you are weeping? She said कि अगर कुछ निकल आया तो मतलब they are so afraid. So because when we spread the awareness that this is a simple investigation जो हर किसी को पता होना चाहिए, so then they will get it done. Thank you, sir. Thank you very much. Just now, can I come on the other question, like the cervical cancer? I just want your opinion regarding the cervical cancer prevention, because this is also again a very dreaded disease. If not treated, cervical cancer can kill the patient. But when it is diagnosed very early, they are in a sin in very early stage, in 1 or in 2, then we can prevent totally by there are so many methods to diagnose and treat it. Sir, your opinion about the cervical cancer prevention and your work.
Cervical cancer prevention is very, very important, and it is preventable cancer.
Right.
And but unfortunately, incidence is very high. It is the second most common cancer, women cancer in India, and fourth most common cancer in the world. The main challenges which we are facing is at three level. One is access, another is first awareness, another access, and third affordability. These three
Right.
are the main, we can say,
So
key
awareness
barriers.
is the first one.
Awareness is the first. And we have seen that most of the women during their lifespan, total lifetime, they never undergone
Right.
any time for pap smear or any
Oh,
investigations. And
yes,
because of
yes,
this,
yes.
they diagnose at advanced stages, and and then its survival is very, very difficult for them. So
Right.
we have, for prevention, we have two things. One is vaccination,
Hmm.
and another we have screening modalities. So the
Right.
vaccinations, now all the guidelines across the world have standard recommendation that between 9 to 14 years, all girls,
Right. Right.
school girls should receive two vaccines at 0 and 6 months. For the HPV vaccine, we can say HPV vaccine. And now there are few studies also available which recommend that one dose is also sufficient. But we are waiting for the government's recommendation. At present, two doses for us in India at 0 and 6 months in the school-going girls between 9 to 14 years.
Right.
After 15 years, up to 20s, after 15 years, the dose increases to 3 instead of two doses, 0 at 2 months and 6 months. And if she is immunocompromised, like if she is having HIV, then at any age, recommendation is for the 3 doses. And now these vaccines are available. Of course, a problem is there still of accessibility and cost is there. But now in our India, our own indigenous vaccine, we can say Indian made vaccine, Sarvarek is
Right.
available. And we hope that this will solve problem in future gradually. So this is about the vaccination, and this is, we can say, primary prevention.
Right.
The secondary
Right.
prevention
Right.
is, we can say, about the screening modalities. And
Right.
that is, we can say, we have three main modalities: pap
Right.
smear, HPV DNA testing, and visual inspection. See,
Right.
with the pap smear, we can identify the abnormal cervical cells.
Right.
With HPV DNA, we can detect
Right. Right.
high strain HPV, high
Yes.
risk HPV strains. And with visual inspection, we can identify the visual changes in the cervix.
Right.
So these are the three methods. And for VIA, visual inspection method, we do not require laboratory. It is immediate result is given, and in the same sitting, same visit, we can also offer the treatment. So it is in
Very
India more or less at
cleaning.
present in government programs, VIA is more there. HPV
Right.
DNA vaccine is or DNA test is available, and in urban area now it is getting more and more popular. It becomes popular, and trend is for HPV DNA testing. Pap
Yes.
smear is the cornerstone for all the private practitioner and all the institutionals. It's an old method, and we all are very much familiar with the pap
Right.
smear.
Right.
So we can say these are the screening modalities, but the important thing is
Right. Right.
uh, this access awareness is जो हमने बात किया कि ये जरूरी है उनको. They do not know the uh, they do not know that the cervical cancer is preventable. They do not know which are the symptoms of cervical cancer, like intermittent bleeding, foul smelling, pain. They do not know these are the symptoms of the cervical cancer. They do not know that it is a sexually transmitted disease, and because of this,
Yes. 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 Yes.
they do not know, and they do not. That is why they do not practice. If they use condoms, simple things, but they do not know. So
Yes.
the awareness is a big problem. They do not know the this all the modalities pap smear, NHPV DNA, and VIA. And when we conducted from Fogsi, we conducted study in Northeast region.
Right.
We found that nearly after all these efforts,
Right. Right.
when we conducted study, it was found that in nearly 64 to 68%, they were not knowing about the cervical cancer.
Right. Right.
So, and when we conducted the study of with the HPV DNA test and with this VIA, we found that incidence was 11% with DNA, and with visual inspection, it was around 12%. So very high.
Right. So,
1 out of 43 women in Northeast region are getting cervical cancer. Such a
right.
high ratio, but they don't know.
Right.
They do not know about it.
Oh.
So awareness is a very big problem. But now I can see the changes in last 5 years in our country, because in 2019 government has signed treaty with WHO, and now FIGO and Foxy and all NGOs are, and IMA also now is active for the cervical cancer elimination. So the more and more awareness is increasing, but they
Yes.
know that mainly this the main reason is HPV infection.
Yes. Yes. Yes.
HPV infection is the main reason, is the main cause, and it has many serotypes, we can say, but serotypes 6, 11, 16, and 18 are the most responsible. They are the responsible for the nearly 84% of the cervical cancers worldwide.
जबकि अभी
So with all
नैनोवेलेंट
this
वैक्सीन
knowledge
भी
and
आ
all
गई.
this
Yes.
vaccination programs, and with all these screening methods, modalities, awareness, accessibility, I think the result will be good, and in next 5 or 10
थैंक यू.
years.
थैंक यू. बहुत अच्छे से आपने बिल्कुल डिटेल में समझाया. मुझे लगता है सभी ने समझ लिया होगा कि एक तो अवेयरनेस बहुत इम्पोर्टेंट है. अवेयरनेस जैसे जैसे हम लोग बढ़ाएंगे वैसे वैसे इसका प्रिवेंशन और बढ़ेगा, क्योंकि अगर 9 से 14 ईयर्स के बीच में ही लड़कियां, मैंने ज़्यादातर अभी कई स्कूल्स में, कई कॉलेजेस में, कई एडोलसेंट गर्ल्स को बताया दैट 9 to 14 ईयर्स में अपनी मम्मा को जाके बताओ कि इस बीच में अगर हमको वैक्सीनेशन लग जाता है तो हमारा 1 डोज से ही काम बन सकता है, उसके बाद हमको 3 डोज लेनी पड़ेगी. तो मेनी टाइम्स मतलब वी आर क्रिएटिंग अवेयरनेस अवेयरनेस अवेयरनेस. फीडबैक कभी कभी क्या मिलता है, जैसे कि कोविड के समय में शुरू में वैक्सीनेशन देने में इवन हमारे प्राइम मिनिस्टर ने भी काफ़ी ज़्यादा अवेयरनेस क्रिएट करी कि सबको लगवाना है, तो भी बहुत से लोग कह रहे थे कि ये बहुत सी कंपनीज अपना सामान बेचना चाहती हैं, वैक्सीनेशन बेचना चाहती हैं. इन द सेम वे वी गॉट टू हियर मेनी टाइम्स दैट ये वैक्सीनेशन इस वजह से. अब लेकिन हमको उनकी अवेयरनेस, उनके पूरा डिटेल में समझाना पड़ता है कि सर ये
So
ये
that is
कारण
why
है. या
that is why two things are very important.
राइट.
There are some like cultural taboos or whatever stigma, whatever it is,
राइट. राइट सर.
but sex education is very important.
वेरी
Number
इंपॉर्टेंट.
two is when we are promoting this vaccine, we should promote the purpose, the basic principle of this vaccine is
वैक्सीन हाउ डज
it
इट वर्क.
should be given before sexual activity starts. So it should be before the, so we can say, sexual debut. So by 9 to 14 years, after that, there
Actually,
is a
sir,
possibility that
there is
girls
there is
or
a there is
women
a
may
thing
expose to.
which we discussed in our meeting also with Dr. Meera Gnotri. We were discussing this all, that when you say this point, then every lady and every patient, they say that our children is not that type. So it's very difficult to say them that get it from 9 to 14. This is a method to prevent the cancer. So you should get between 9 to 14 years, and at that very age, you will get only one vaccine. After that,
And
you will
third
get
point is,
3.
if you are taking before 14 years, you may need only 2 doses.
Yes, yes.
After that, you may require 3 doses.
3 doses. So even nowadays the government is coming with the 1 dose concept also.
Yes, 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 yes. There are several studies which
Yes.
suggest the 1 dose is sufficient.
Yes, yes, and very rightly said, because this is preventable, so there is a lack of knowledge. And we did, even you said, as HPV vaccination is very good, and the smear, pap smear, which we are taking, that was our old method. Now we are doing VIA in camps to lot many, even 100 patients were there, and we did VIA, and so did we examined so many patients of early cervical cancer and did their cryotherapy and cryocorty and different type, and we cured that patient and saved them. So, sir, what is your message for all the
I would
country
also
person?
like to add one thing here. I would also like to add one thing here. They should also know the frequency, how frequent they should undergo this pap smear and when. So
Right.
if between 21 to 29 years of age, every 3 years they should go undergo pap smear. If it is between 30 to 65 years, then pap smear every 3 years, H or DNA, HPV DNA at every 5 years, or co-test where both the things pap smear and HPV DNA test, then it is to be at every 5 years. So they should know it. ऐसा नहीं है कि एक बार हमने कर लिया पेप स्मीयर तो बात खत्म हो गई, रिपोर्ट नॉर्मल आ गया तो भी अब कुछ होने वाला नहीं है, नो, इट
एंड
इज
दूसरी
नॉट।
चीज सर, ये भी इम्पोर्टेंट है कि अगर आपने एक बार वैक्सीनेशन लगवा दी है, उसके बाद भी आपको स्क्रीनिंग करानी है। ये हमें उनको बताना होगा कि दैट इट प्रोटेक्ट्स यू, लेकिन आपको जांच करवाते रहना है फिर भी, इफ यू आर
Yes,
अंडर हाई
they
रिस्क।
should know all these things very clearly.
जी जी सर, थैंक यू बहुत, आपने हम सबकी नॉलेज बढ़ाई। मैं अंत में आपसे 2 लाइन में, सारे फॉक्सियंस भी जुड़े हुए हैं एंड अदर पैरामेडिक्स भी हैं, तो सर आपका क्या संदेश है सबके लिए? What message is on behalf of you, on the behalf of Foxy, on behalf of past president of Foxy, sir, who did a lot much of work regarding this prevention of NCDs and breast cancer and cervical cancer, sir?
See, I would say primary onus is to us.
Yes, sir.
We should take this responsibility of public health education, awareness, and screening. See, if you look at the recent incidents of COVID, आप किसी को भी पूछो, even you just ask any vendor, anybody, street vendor, how to prevent COVID. उन सबको पता है मास्क पहनना है, हैंड वॉश करना है, सोशल डिस्टेंसिंग करना है, वैक्सीन करना है. So
Right.
when we can educate them, then why we cannot educate them for cervical cancer? Okay, so and why we got this much good response, because they all were convinced and they all took vaccine. So here also we should learn from COVID. So what I would suggest is, every woman deserves the power of prevention. With timely vaccination, regular screening, and healthy daily habits,
Right.
by avoiding risk factors, we can stop cervical and breast cancers before they start. Awareness, access, affordability are the key key factors or challenges. But awareness isn't just protection empowerment. Let us make women's health a shared priority and not a silent challenge.
Very good. Yes, sir.
We all need to work together, organizations, NGOs,
Right.
government, media, and at personal level, to help our women. Jointly, I hope we can also solve this problem in next 10 years. I'm very optimistic. Thank you very much for inviting me and honoring me.
थैंक यू सर, बहुत बहुत धन्यवाद हमारे ज्ञानवर्धन के लिए। एक बार मैं फिर कहूंगी, हमें हम सबको मिलके कैंसर से लड़ना है। कैंसर से लड़ना है, डरना नहीं है, डरना नहीं है। रोकथाम से जीवन संवारना है, रुकना नहीं है। आपने सर हमको एनलाइटन करा, इसके लिए बहुत बहुत धन्यवाद। मैं आभारी हूँ आपकी भी और फॉक्सी प्रेसिडेंट डॉक्टर सुनीता मैडम की। इसी के साथ सभी को नमस्कार, प्रणाम और धन्यवाद।
Thank you. I am thankful to Dr. Sunita and you, Dr. Kanchan and Foxy.
थैंक यू
Thank
सर,
you.
थैंक यू।
And I hope it will be helpful to our listeners, viewers
डेफिनेटली,
across India.
डेफिनेटली, डेफिनेटली। थैंक यू वेरी
Thank
मच।